Thank you very much. Hello everyone, my name is Alex Liarakos and today I'll present the long-term real-world outcomes of hybrid closed-loop therapy in adults with type 1 diabetes in the UK on behalf of the ABCD closed-loop audit contributors. These are my disclosures. Evidence from randomized controlled trials indicates that the use of automated insulin delivery for up to 96 weeks in type 1 diabetes is associated with a significant reduction in HbA1c of 0.4% and an increase in time in range of almost 11% compared with usual care. However, the mean baseline HbA1c was 7.7% in these studies, which is not what we observe in clinical practice. In the summer of 2021, NHS England launched a pilot to provide access to hybrid closed loop for adults with type 1 diabetes managed with insulin pump therapy and intermittently scanned CGM with an HbA1c of at least 8.5%. Alongside the pilot, the ABCD audit program, which involves a national real-world database covering a wide range of diabetes-related therapies and technologies, launched the closed-loop audit. Anonymized routine clinical data were submitted to a secure online tool, and we aimed to capture real-world outcomes of hybrid closed-loop in type 1 diabetes. The 6-month follow-up data have already been published. As you can see in the slide, HbA1c significantly reduced by 1.7%, time in range increased by 27%, diabetes distress and goal score also improved. Today, I'm going to present the latest follow-up data of this analysis. Over a median follow-up of 20.4 months, 150 adults from 12 centers had paired baseline and follow-up HbA1c data and were included in this analysis. Baseline characteristics: our population had a median age of 38 years, 65% were female, 91% white with a median diabetes duration of 20 years. And here are the HbA1c results. As you can see, HbA1c reduced from 9.3% at baseline to 7.7% at follow-up, a mean reduction of 1.6% or 17 millimole per mole. Sensor outcomes, again, time in range significantly increased by 24%, time above range and time below range reduced. Regarding the patient-reported outcomes, as you can see in the slide, diabetes distress significantly improved with hybrid closed-loop therapy. Goal score reduced by 0.6 points, and impaired awareness of hypoglycaemia also significantly improved. In conclusion, our study with a long-term follow-up of almost 2 years indicates that in the real world, hybrid closed-loop therapy is associated with sustained improvements in glucose and patient-reported outcomes, as evidenced by reduced HbA1c, improved time in range, reduced time above and below range, as well as improved diabetes distress and hypoglycemia awareness. And all these benefits were achieved without increased rates of DKA, hypoglycemia, hospitalization or paramedic use. Would like to thank all the audit contributors and NHS England, with special thanks Professor Pathaka for their support. Thank you very much for listening.
Thank you very much. Presentation, yeah, please.
Thank you very much, Outcome from Medtronic. I have a question. Very important messages here, but I'm asking about the outcome. You have a 62% or 64% time in range, I cannot see exactly, which is lower what we've seen in Italy in both presentations, real world and both real world evidence.